We'll call on Ms. Raquiza of Social Watch Philippines.
Good morning, Mr. Chair, the Senate Committee on Finance, and fellow CSO colleagues. I speak on behalf of Social Watch Philippines and our partners under the Alternative Budget Initiative. This is a coalition of more than 100 civil society organizations, many of whom represent the poor and marginalized groups, who for nearly 2 decades, we have been working to promote citizens' participation in the national budget process. Since the 13th Congress, we have secured tangible gains by working closely with members of Congress and the executive, so that we were able to secure tangible gains in raising the budgets for health, education, social protection, as well as child protection. However, since we were only invited yesterday, we were not able to prepare a PowerPoint presentation. Nevertheless, our intervention today has 2 parts. First, we will present our observations and recommendations on the worsening problem of graft and corruption and the urgent need for transparency, accountability in the budget process, including improving public ethics. However, second, we present ours and our partners' budget proposals in education, health, social protection, and child and mental health. Since the good senator has mentioned, if we free up public funds from certain items, where can it be reallocated? It is in that regard that we will make concrete proposals. And we will because we were only given about a few minutes, given that we have many partners who will be presenting, we hope to give you the full proposal after this meeting. So part 1, on corruption, transparency, and accountability. Much of the budgetary gains of recent years have been overshadowed by developments exposed through the flood control scandal and similar controversies, revealing alarming levels of graft and corruption that has eroded public trust. Over 3 months have passed since the President's "Mahiya naman kayo" speech, yet we have seen no decisive action to hold those accountable, no decisive action to hold accountable those responsible, especially when it comes to the big fish. Public frustration is indeed growing. As a citizens' budget watchdog, we have long observed troubling issues in the budget process. Limited participation of citizens group during budget presentation, lack of publicly available documentation of bicameral conference budget realignments, preventing scrutiny of changes to the tune of hundreds of billions of pesos, the 89.9 billion transfer of PhilHealth funds, which threatened the sustainability of universal health care, and the zero budget for the state insurer in 2025. The rapid expansion of flood control projects without transparent planning or monitoring, raising red flags on equity and misuse. The practice of providing allocable funds assigned to legislators within agency budgets, the highly discretionary and arbitrary use of special purpose funds, the disturbing rise in the amount of confidential funds in recent years, and the limited access of civil society groups to ongoing budget deliberations. So our call for reform, we urge Congress and the executive to act decisively in strengthening transparency, accountability, and citizens' participation throughout the budget process. During budget preparation, do open the process to public scrutiny and invite civil society and stakeholders to meaningfully participate. During budget legislation, while we commend the Senate for concurrent resolution number 4, we recommend the following: adoption of a fully open bicameral conference through a joint resolution that goes beyond mere live streaming. Disclosure of legislators' names and their individual amendments in all versions of the General Appropriations Bill. Public access to budget documents in machine-readable formats, a recurring point mentioned by my colleagues. abolition of the small committee, or BARC, which operates in secrecy, limiting BICAM deliberations to reconciling House and Senate differences, and avoiding closed-door sessions, especially when decisions are being made. And enacting into law, once and for all, the citizens' participation, the bill on the people's participation in the national budget process bill that has been filed for several Congresses now, but has never seen the light of day, because this will also help ensure CSO involvement in all phases of budget making. Now, on the questionable budget allocations, we respectfully appeal to the Senate to delete or realign pork-laden insertions in the House version of the 2026 GAB and revert them to the NEP levels. This can serve as funding sources for Social Watch Philippines alternative budget initiatives proposals amounting to 296.8 billion pesos. Among these contestable items are 32 billion for AIX under DSWD, 10 billion for TUPAD, 10 billion for presidential assistance to farmers and fisherfolks, 16.8 billion for farm-to-market roads, 31.8 billion in DepEd's basic education facilities outside of the agency budget request, 10.5 billion in the House of Representatives additional budget without clear basis for such budget increase, 41.3 billion under DPWH CPAG's projects. We also urge deletion of the 49.2 billion medical assistance to indigent and medically incapacitated patients MAIFIP fund, which has become a vehicle for political patronage, and to reallocate this to PhilHealth and to DOH to strengthen its capacity to implement the no-balance billing policy and better realize universal health care. Apparently, we have a meeting of the minds here. Likewise, we propose the removal of the 90 billion Basic Infrastructure Program, or BIP, as it duplicates DPWH CPAG projects. Finally, on unprogrammed associations. In recent years, unprogrammed appropriations has served as a repository
Yung BIP tsaka yung basic infrastructure and CPAG, our staff's recommending to merge it kasi we saw the criteria or the qualifications, pareho lang naman eh. So it's actually confusing. Bakit may basic infrastructure, may CPAG?
Exactly.
It's actually the same. So
Actually.
yeah, may meeting of the minds
Yeah.
tayo.
Yeah.
Sige, merge namin ho yun.
Okay. Thank you. So the UA has served in recent years has served as a repository for pork allocations disguised as contingency funds or loan-backed spending. Contingencies can and should be covered by programmed appropriations already available in agency and special purpose funds. Related to the 2026 UA, we suggest to delete the SAGIP budget item and integrate many of the other budget items to existing agency budgets. Now, part 2, I will go to the alternative budget proposals. The Education Network Philippines, of which my colleague, Professor Flora Aleliano, heads, she's right here, they have noted that despite modest increases in the 2026 NEP, millions remain excluded from quality education, especially out-of-school youth, children with disabilities, indigenous peoples, and Muslim learners. As such, we call for 12 billion in additional funding to strengthen alternative learning system, special needs education, early childhood care and development, teacher support and education in emergencies. And the Education Network has a full paper on this, which they can and will happily submit to the Senate committee.
Professor Flora, magkasama kami sa EDCOM. We're both EDCOM members. She's one of our commissioners. Kaya sigurado pag education pareho yung iniisip namin kasi I've been the chairman of the Basic Education Committee for 6 years and maraming batas ang init kasama namin tulad ng ALS law, mental health law, inclusive education, yung teacher excellence law. So we welcome your suggestion, Ma'am Flora. Yeah, we can talk about that later after ni Dr. Raquiza.
That's great. Thanks a lot. Sa usapin naman ng health, the Abbey Health Cluster warns that the universal healthcare law is being undermined. PhilHealth, which requested 242 billion for 2026, was granted only 53 billion, or 22% of its requirement. While it is true that 60 billion was added by Congress, it is for benefit improvement and not a recognition. We do not view this as a recognition of the return of what was taken away in the previous year. And I can explain why should you want an explanation. Anyway, meanwhile, the MAIFEP fund ballooned from 24 billion to 49 billion pesos. This so-called compassion fund is in truth patronage politics, replacing citizens' rights with political favors. We demand the full restoration of PhilHealth budget and the automatic transfer of earmarked sin tax, PCSO, and PAGCOR shares to PhilHealth as mandated by law. Now, in relation to social protection, led by Life Haven Center for Independent Living, the Social Protection Cluster proposes a disability support allowance to provide 2,000 pesos monthly assistance to persons with severe disabilities. There are about 345,000 Filipinos nationwide. The total annual budget required is 8.78 billion, including administrative and contingency funds. This will address the higher cost of medicines, mobility, and care faced by persons with disabilities. Finally, in relation to child protection and mental health, as we know, child protection and mental health are among the most urgent social concerns today. As such, we propose the following: 6.84 billion to hire plantilla personnel under the Basic Mental Health and Well-Being Promotion Act of 2024, 45 million pesos for the Tier 2 budget of DepEd Child Protection Program, 18.3 million pesos to strengthen child participation in preventing online sexual abuse and exploitation, and 122 million for 38 DOH hospitals with women and children protection units providing medical and psychosocial care to survivors of abuse. You know, all of these proposals have very detailed aspects to it, but in the interest of time, we have abbreviated this. Again, we can send you the full proposal. Yes, would you like to? With your permission, Senator, Professor Flora would like to add something before I conclude.
Yes. Oh, yes.
Thank you very much, Senator Win, our champion in the Senate. Public funds must serve public good, and education is a constitutional priority. In this regard, it must be protected from political capture and corruption. Now, these are our final recommendations, sir. Protect the integrity of the DepEd budget and ensure that approved increases, example, the special needs education, IPED, ARAL, SB, school feeding program, are not only retained but further enhanced in the Senate. Prioritize ALS and ECCD, which continue to receive the smallest budget shares despite serving the most disadvantaged. Conduct legislative oversight to ensure inclusive education policies such as RA 11510, RA 116650 are funded and implemented with fidelity. It's not only good that we legislated these laws, but there must be investment in order to implement fully these laws. So this is where we would like to ask your intervention. And then, Senator, this is our long-term collaborative project to fund the Magna Carta for public school teachers' provisions. Up to this time, it was not fully implemented. And we suggested to the Secretary of Education to have a collaborative project about this. So we can help also in crafting the contents of the Magna Carta, as well as the roadmap. Since we have already started with roadmaps in teacher excellence in teacher education, probably this is high time to create also the roadmap for the Magna Carta, as you have already advised before. And then ensure transparency and people's participation in budget planning, execution, monitoring across all levels. We thank you, Senator Win, and the Senate for opening these democratic processes and space, and reaffirm our commitment to people-centered and equitable public budgeting for education. Thank you, and that's all.
So in conclusion, in total, we propose 216.78 billion in additional funding for social development, financed by 297 billion, which we identified from contestable allocations. Honorable Senator, colleagues, as we know, the national budget is not just a financial document. It's a moral contract, a social contract, a moral contract between the government and the people. Must serve us as a culture of lead the way towards a transparent, accountable, and people-centered budget. One that will address the serious trust deficit that the government now confronts. One that restores the Filipino people's faith in government. Thank you, Mr. Chair and members of the Senate Committee on Finance, as well as good noon to my colleagues. Thank you.
Thank you, Dr. Raquiza. Dr. Raquiza, you recommended to allocate 216 billion pesos for social development, and particularly taking that from the flood control or yung mga ibang mga projects na tingin natin ay hindi naman kailangan. But which, I asked this kay AJ kanina, but which social development programs in particular of the government, whether existing or non-existing, should we allocate it to? Sa tingin nyo, marami kasing programa ang gobyerno eh. But sa tingin nyo, saan pwedeng i-allocate yan na sustainable, and also yung sinabi nga kanina ni AJ na rules-based and rights-based approach, which I agree actually. I think it's a sustainable, rules-based and rights-based is a sustainable approach to programs eh. Rather than yung increase ka ngayon, next year wala na naman. So, ganun nakikita natin actually sa ibang mga programs, di ba? Konti lang, biglang tataas, biglang bababa. So, hindi siya, in the eyes of the people, parang hindi mo alam kung matutulungan sila o hindi matutulungan. Unlike kay rules-based, pag andyan ng rules, andyan na yung tsaka rights ng mga tao yan, lalagyan natin ng pondo. Tuloy-tuloy lang yon. So, which program in particular do you think we should allocate it to?
As we specified in my presentation, we're asking for 12 billion in the terms of education, and we actually have a breakdown of cost for ALS, system for special needs, early childhood and development, teacher support, education and emergencies. That's just for education. For health, we believe that funding for PhilHealth, the request is actually 242 billion, and so far what has been given to it by both NEP and HGAB is less than what it has requested. So we have a long way to go in fulfilling our mandate in relation to PhilHealth. Of course, as you rightly said, Mr. Senator, Honorable Senator, DOH badly needs funds to be able to strengthen its capacity for zero balance billing. And looking at the budget, that can certainly be much more improved. Because napaka-inclusive nun eh. If the 83 DOH hospitals can be better financed. Apart from that, we have very specific proposals for disability,
persons with disability. We have partners who wanted to come, but they can only come in wheelchairs, many of them, and they have personal assistants. And so that's another thing that we would like to raise later on in the invitation of civil societies.
Maybe there can be special provision so that our partners in the peoples with disability sector and senior citizens, maybe special provision may have to be made for them to be able to more meaningfully participate in these kinds of sessions. And then we also talked about very specific proposals for child protection and mental health, sir. And we can give you the breakdown. I already said 6.84 billion to hire plantilla personnel for basic mental health and well-being. There's a program around this. 45 million for the Tier 2 budget of DepEd, Child Protection Program. 18.3 million to strengthen child participation for OSAEC, in preventing OSAEC. And 122 million for the 38 DOH hospitals that have women and children protection units providing medical and psychosocial care. These are very specific and concrete proposals, and we will be more than happy to share this with you.
In fact, we're in line with yung sa human trafficking and OSAEC. We had a hearing here, and Senator Lauren and I agreed to improve the budget of yung AYACAT, yung interagency fighting human trafficking as well as fighting OSAEC, yung online sexual abuse of children. So we're boosting the budget of those two agencies para mas malawak pa yung kanilang reach, kasi napansin ko, sad to say, but lumalala itong dalawang social ills of our country, and because of poverty rin, because of poverty, because of our very porous borders in the south. Marami tayong mga cases of human trafficking. And in education, alam ni Ma'am Flora yan na ang aking puso talaga nasa education. And we're very happy to say that ang education natin for this year will breach 4.3% of GDP. At about 1.3 trillion pesos. So that's first time in history. Although ang recommendation ng ACT is 6%. 6% is about 1.8 trillion. So may balance pa ng around 400 billion. So but at least we have reached that 4% of GDP. Ang tanong naman, we have to spend it on the right amounts or the right programs, tulad ng ALS, tulad ng mental health, tulad ng sa mga teachers natin, which I agree. Alam ni Ma'am Florian, we kikita kami almost every week at that time. So and we welcome your suggestion. Please send us the details so that we can study it.